one module which is called as ICD-10-CM. What it is? ICD-10-CM. So ICD-10-CM is nothing but International Classification of Diseases, 10th clinical modification. 10th clinical modification. So like how we have like too many universities available, in that same manner, so we have an organization is there. So that organization is called as AAPC. What it is? AAPC. So this AAPC is nothing but American Academy of Professional Coders, right? So this AAPC will have certain certifications. So out of all those certifications, CPC is the one of the certification. CPC is the one of the certification. So from this CPC certification, so we have around how many? 3 modules are there. One is CPT, second one is ICD, and the third one is HCPCS. HCPCS. So CPT is nothing but current procedural terminology. ICD is nothing but International Classification of Diseases. HCPCS is nothing but Healthcare Common Procedural Coding System. The CPT we are using to report procedures, right? And ICD we are using for the diagnosis, and HCPCS we are using for the equipment. So equipment is nothing but, so during the treatment, so whatever the medical emergency things, medical kits or instruments that the provider is using, right? So all those things will be using by using this module called ICD-10-CM. What it is? ICD-10-CM. Sorry, HCPCS, Healthcare Common Procedural Coding System, right? So this is one point we have to remember in terms of this ICD-10-CM, right? So can you all repeat after me? What is ICD-10-CM? So ICD-10-CM is nothing but International Classification of Diseases, 10th clinical modification. 10th clinical modification. So this clinical modification is nothing but version. What it is? Version. So right now we are using the 10th version of ICD-10-CM. 10th version of ICD-10-CM. So we do have ICD-11-CM also available. ICD-11-CM also available, but ICD-11 is called as AI coding. What is that? AI coding. So that AI coding is, right now it is not in a use. It is not in a use, right? So that is one thing we have to remember. So right now we are using only ICD-10-CM, which is called as 10th version of ICD-10-CM. What it is? 10th version of ICD-10-CM, right? So coming to this manual, so this is actually considered as a manual, but you guys are not going to get this manual. So if you want, I'll also provide this manual, but you guys are not, you guys cannot be able to handle this book in mobile phones or laptops, right? So because it containing 1456 pages. How many? 1456 pages this book is contained. So complete 1400 pages are related to diagnosis. So diagnosis are nothing but conditions, right? So for example, we have general coding guidelines are there, we have convention guidelines, we have chapter specific guidelines, right? So for example, we have diabetes, right? So diabetes belongs to endocrine system. So endocrine system related all guidelines are given in this ICD manual, right? And we have digestive system. So whatever the conditions will comes under digestive system, so all those conditions will be placed under this digestive system. And we can see here skin related disorders. All skin related disorders are given under this skin. What it is? Skin related section, right? So this is how we'll be having around 22 sections available. How many? 22 sections, which means 22 chapters available in this ICD-10-CM. So in this 22 chapters, we are going to learn how to lead the code, what is the structure of the code, right? And how we are using the codes and how many letters that ICD-10-CM code contains, right? So these are all things we are going to discuss from this 22 chapters. How many? 22 chapters. So in these 22 chapters, we can see here, so like we have ICD-10-CM official coding guidelines reporting following year 2026. So that means every year the book is updated in the month of October. So but we are using this ICD-10-CM from the month of January, right? So that is the reason why. So 25 and 26, how we will consider it? 25 and 26. So 2025 to 2026. So which means whatever the updates, whatever the deletes that AAPC wanted to do, right? So they will be making all those changes in the month of October every year. So that is the reason why. So like these ICD-10-CM guidelines are used from the month of January. From the month of January, right? So this is one point we have to remember, right? And first we can see here preface, list of features and practical steps for using ICD-10-CM codebook, symbols and conventions, anatomical illustrations, ICD-10-CM index to diseases and injuries, neoplasms. So we have, but like neoplasms. Neoplasms are nothing but cancers. So for cancers we have separate section available, diseases we have separate section available, and drugs related codes we have separate section available. And the next one is that external causes related things we have separate section available. And the final one is diseases and injuries. Diseases and injuries. So for every diagnosis we have particular department or particular section available in the ICD-10-CM manual. In the ICD-10-CM manual. So in this, if we check this chapter 1, so chapter 1 is nothing but certain infections and parasitic diseases, and these codes are starting from within the range of A002 B99. A002 B99. So what does it mean? It means that whatever the infections are there in the body, so all those infections are placed in the chapter 1. So which means, so whatever the codes that you get to see, A002 B99, A002 B99. So like if you get to see any code within this code range, you will have to think that this code is related to what it is. This code is related to infection or syndrome, right? So these are all the codes related to syndromes and infections. So infections are nothing but we can see here syndromes, MRSA. What is that? MRSA and MSSA, Zika virus, right? So virus infections, right? So all those codes are given within the code range A002 B99. A002 B99. For example, if you got any cancer condition, in a medical record, then where you need to check that cancer related codes. So we have to check those cancer codes in the chapter 2, which is called as neoplasms. What it is? Neoplasms. So for this neoplasms, we have a separate table available in this ICD-10-CM manual. Which is called as neoplasm table. So this is the second chapter. So which means whenever we get to see any condition or any diagnosis related to cancer, so we'll directly going to the table of neoplasms, and we are trying to search the code for any particular cancer. And if you got a condition called kidney cancer, and you are searching that code by using the you are trying to search the code by using this certain infections and parasitic diseases section, but you will not get the code for the neoplasms. You will not get the code for that neoplasm, right? So this is one point we have to remember. Right? So that is one thing. This is second chapter is related to neoplasms. What it is? Neoplasms. And the third one we can see here, disease of the blood and blood forming organ disorders involving immune mechanism. So why I am repeating all these things? Because you guys have to know what is A category, A002 B99 category, and what is C002 D49 category, and what is D50 to D89 category. So you guys have to know. So for example, if you get to see any code which is starting with D letter, what it is? D letter. Then how we have to consider that, okay, this D letter condition is related to blood and blood forming disorders. For example, if you get to see any code which is starting with A letter or B letter, right? So then you will have to consider that as an infection or the syndrome. So is it easy, everyone? Yes, I need an answer from the chat box. Yes, everybody. Is it clear? Everybody is paying 100% attention here, or you guys have joined the session and you are roaming somewhere? Yes? Yeah. So that is related to third chapter. And coming to fourth chapter, so this fourth chapter is related to endocrine, nutritional and metabolic disorders. So endocrine system related, all the conditions are listed in the chapter 4. And next one we have chapter 5. So chapter 5 is related to mental disorders. What are these? Mental disorders. So endocrine system example we have hypothyroidism, hyperthyroidism, diabetes mellitus, right? And we have malnutrition, right? So all those conditions will comes under this endocrine system disorders. disorders. And the next one we can see here, chapter 5, which is related to mental and behavioral disorders. Mental and behavioral disorders. So mental disorders like depression, bipolar disorder, panic disorder, right? So and we have PTSD, right? So all these conditions will comes under this chapter 5, and these codes will start from F01 to F99. F01 to F99. And next one we can see here, chapter 6. So this chapter 6 is related to G00 to G99. G00 to G99. So nervous system related disorders, hemiplegia, monoplegia, paraplegia, quadriplegia, right? So all these conditions will come under chapter 6. And chapter 7 is related to diseases of the eye and adnexa, right? So whatever the conditions which are related to eye, right? We have glaucoma, right? We have ocular hypertension, right? So these all Sika syndrome, right? So all these conditions will come under chapter 7, right? H category. Which category? H category. And ear and mastoid process. Ear and mastoid process. So ear and mastoid is nothing but, so the conditions or the diagnosis related to ear. What are these? Ear. So all these conditions will come under chapter 8. And chapter 9 is related to circulatory system, hypertension, heart failure, right? Cardiomyopathy, and we have atrial fibrillations, right? And these all conditions will come under circulatory system, and all circulatory system conditions will start with I00 to I99 categories. I00 to I99 categories. And next one we have chapter 10. So this chapter 10 is related to respiratory system related disorders like, COPD, asthma, emphysema, right? And respiratory disorders, COVID-19, right? So all those conditions will fall under this chapter 10. And next we can see here chapter 11. So chapter 11 is related to digestive system. So this digestive system related, we have GERD, right? Ulcerative colitis, Crohn's disease, right? So all these conditions will come under this chapter 11. And the next one is chapter 12. So this chapter 12 is related to skin and subcutaneous tissue. Skin and subcutaneous tissue like ulcers, right? And psoriasis, right? So these type of conditions will come under this chapter 11. And chapter 12 and chapter 13 is related to musculoskeletal system related disorders. Musculoskeletal system related disorders. So musculoskeletal system related fractures, things, osteoporosis, osteopenia, right? So all these conditions will come under musculoskeletal system. And genitourinary, so this is very simple. So we have only one condition available, which is called as CKD. What is that? CKD. So CKD is nothing but chronic kidney disorder. Chronic kidney disorder. And next one we can see here, 15th chapter, which is related to pregnancy. So whatever the codes during the pregnancy, whatever the diagnosis that a patient is getting during her pregnancy, right? So all those diagnoses will have a separate code sets, right? So those code sets are listed in chapter 15 in ICD-10-CM manual. ICD-10-CM manual. So after the pregnancy, there is a delivery, right? So delivery means what? Small baby. What is that? Small baby. So small baby, we can see here chapter 16. So certain conditions originating in the perinatal period like P002, P96. P002, P96. That means newborn related codes. All newborn related codes are, organized in chapter 16. Where? Chapter 16. And chapter 17 is related to congenital malformations. What are these? Congenital malformations, deformations, chromosomal abnormalities, right? So whatever the condition that was established, right? So during the birth, right? So puttagane konni conditions aneti manaki establish aitu untai, right? So all those conditions are related to or mapped or organized under chapter 17. Which chapter? Chapter 17. And congenital conditions, all congenital conditions will start with the letter Q. Which letter? Q letter. After that, signs and symptoms, injury, poisoning, external causes, factors influencing health status, contact, and we can see here codes for special purpose, right? So these are all 22 chapters available in ICD-10-CM. So each system will have a separate code series. For example, we have circulatory system. So circulatory system starts with I category. We have respiratory system which starts with J category. For example, we have skin related disorders will starts with L category. So which means A to Z. What it is? A to Z. So whatever the condition, right? So based on that system, right? So each and every system is tagged to one alphabet from the alphabets, 26 alphabets, right? So this is single point that we need to remember. Everybody clear with this 20 chapters? Yes, no? Everyone clear with this 20 chapters? 22 chapters, I'm so sorry.